new infections have gone up slightly in the last couple of years, less so in men who have sex with men. So, they went down and then they're sort of edging up a little bit. But in women, they went up 30%. And why are they going down in other groups and not necessarily in women? And some of that has to do with the messaging around prevention and PrEP and so on, which is targeted towards men who have sex with men. And that's absolutely fine. And it's as it should be. And we know that the biggest fall in new HIV diagnoses has been in men who have sex with men, in white men who have sex with men. But the problem is that an HIV prevention message that targets men who have sex with men is not going to resonate with women. And so women will never, ever engage with those messages. And if you think about it, what HIV prevention campaigns have there been that have been directed towards women? And so women just do not perceive that they have anything to do with HIV. And so when they're diagnosed, it's like, oh my God. And I have a lot of women patients, and I cannot think of a single one for whom the diagnosis was not a complete shock.
Yeah. Yeah.
Because they're not thinking about it. And when we think about HIV in the UK, we think about men who have sex with men, and we generally think about Black people.
Yeah.
But we all know many, many, many people living with HIV who do not fall into any of those categories, for whom HIV messaging is never, ever directed at. And when you think about people who are marginalized, in my experience, white women with HIV are some of the most marginalized people with HIV in the UK, because, often they live in little villages where everyone knows everybody else, and they've known their GP for their whole life, so they cannot talk to their GP. And if they go to their GP, then they know that the whole village is going to know their HIV diagnosis. So they have to travel a long way away from their home to a clinic. They don't have support. They don't feel they can talk to anybody.